Hello everyone. This video presentation will be on the pathophysiology of type 2 diabetes. A quick background of type 2 diabetes is that it is associated with certain genetic predispositions, environmental factors, lifestyle choices, and the dynamic interaction between all these different aspects. The ailment is a disease state which involves the dysfunction of insulin-producing pancreatic beta cells, insulin hormone resistance in cells of the body, or a combination of both. Diabetes mellitus type 2 is a condition that typically begins with the resistance to insulin by the cells of the body that also worsens over time. This resistance and the compensating production of insulin by pancreatic beta cells may eventually lead to beta cell failure. And as a result of the beta cells failing, endogenous insulin can no longer be secreted. An overview of type 2 diabetes is that this disease is one of the most common metabolic disorders, and it is caused by a combination of two primary factors: defective insulin secreted by pancreatic and the inability of insulin-sensitive tissue to respond appropriately to insulin. Because insulin release and activity are essential processors for glucose homeostasis, the molecular mechanism involved in the synthesis and release of insulin, as well as its detections, are tightly regulated. Defects in any of the mechanism involved in these processes can lead to metabolic imbalance, responsible for the development of the disease. Now let's analyze the key aspects of type 2 diabetes, as well as the molecule mechanism and pathway implicated in insulin metabolism leading to type 2 diabetes and insulin resistance. Here now we're going to take a look at the pathophysiology of type 2 diabetes mellitus. In the pathophysiology of the disease, a malfunctioning of the feedback loops between the insulin action and the insulin secretion, resulting in an abnormal high glucose level in the blood. In the case of beta cell dysfunction, insulin secretion is reduced, limiting the body capacity to maintain physiological glucose levels. On the other hand, insulin resistance contributes to increased glucose production in liver and decreased glucose production and decreased glucose uptake both in the muscle, liver, and adipose tissues. Even if both processes take place earlier in the pathogenesis and contributed to the development of the disease, beta cell dysfunction is usually most severe than insulin resistant. However, when both cell dysfunction and insulin resistance are present, hyperglycemia is amplified, leading to the progression of type 2 diabetes. When are they diagnosed? According to American Diabetic Association in 2014, the diagnosis of type 2 diabetes mellitus can be made after establishing one of the following. 1. A glycosylated hemoglobin or hemoglobin A1C greater than or equal to 6.5%. A fasting plasma glucose greater than 125 milligrams, a 2-hour plasma glucose greater than or equal to 200 milligrams during oral glucose tolerance tests, a random plasma glucose greater than or equal to 200 milligrams in a patient who is exhibiting signs and symptoms of hyperglycemia. Here are some contributing factors to the disease type 2 diabetes mellitus. Type 2 diabetes mellitus risk factors include a complex combination of genetic, metabolic, and environmental factors that interact with one another, contributing to its prevalence. Now, although individual predisposition to type 2 diabetes due to non-modifiable risk factors has a strong genetic basis, other factors include unhealthy diet, 40 years or older, obesity, low physical activity, and also if you're an African American, Hispanic, Latino, African Indian, or Alaska Native person. Here is a quick story of a person sharing their type 2 diabetes experience.
My name is Dan Laurinaitis. I'm 45 years old. I'm a professional entertainer. More specifically, I'm a comedy hypnotist. I try to everybody's diet. My name is Dan Laurinaitis. I'm 45 years old. I'm a professional entertainer. More specifically, I'm a comedy hypnotist. I try to everybody's diet. Friends, neighbors, people I'd work with, other entertainers. Occasionally I would lose a couple of pounds, I'd get excited, but then I go on the road, everything changes. Getting up wee hours of the morning to rush to an airport. So I'm grabbing
a different diet plan and an exercise program. For exercise, we talked about 150 minutes a week of moderate intensity exercise, but the focus of his plan was a low carbohydrate or a low sugar diet. Reason for that is a low carbohydrate diet helps with insulin resistance, which is the best management of the metabolic problem in type 2 diabetes. My ultimate goal for Dan is to stop his oral medication and to reverse the metabolic problems in obesity and type 2 diabetes.
It was tough. It was tough for me the first few days. I mean, I don't know how many times I wanted to drive my Jeep through the front window of a Dunkin' Donuts, but I got past that. Dr. Alpern's plan has been very successful for me. I've lost 52 pounds, and it's sustainable. The key, I think, for a big part of the sustainability for me to keep the weight off is to learn and to manage this while I'm on the road, since I do travel so much. I wasn't going to the gym, so I just started introducing myself to walking. So I was walking every day. I started just a mile, worked myself up to 5 miles a day. Rain or shine, first time in my life, I'm looking at the nutritional side of the box with the carbs and the low sugars, and I'll grab beef jerky instead of the donut. Dr. Alpern opened my eyes up to the fact that it's not me being at the gym for 2 hours a day. The diet that I'm on is going to be for the rest of my life, and I know that I can do it, and I have that confidence now that moving forward that I'm going to continue losing weight. 52 pounds makes a big difference, and I'm happier now than I've been for years and years.
Now we're going to look at the pathophysiology of hypertension. Hypertension is a condition that occurs in the body which causes the pressure in your blood vessels to consistently elevate. Hypertension doesn't have any warning signs or symptoms. This is also known as the silent killer. The mechanism behind hypertension is that it is caused by the disorder of two systems involved in the regulation of salt-water balance and the cardiovascular function, the RAAS and the SNS. The RAAS is that the background behind RAAS is renin is an enzyme that causes a reabsorption of sodium and water. The angiotensin is converted to angiotensin 2, which constricts arterioles, causing blood pressure to increase. This also triggers the adrenal gland to release antidiuretic hormones. Aldosterone, along with ADH, causes retention of sodium in the kidney, which water follows. This increases blood volume and blood pressure. The SNS. The main role of the SNS is to respond to dangerous or stressful situations. The SNS also regulates arterial blood pressure. Here are the types of hypertension. They are primary, secondary, malignant, and resistant. Hypertension is one of the complications of diabetes due to sodium remaining in the vessel, which water naturally follows. This causes the blood vessels to narrow, and with the blood vessels narrowing, the blood volume increases, and the blood pressure also increases to compensate for all of the fluid. In the primary hypertension, it is known as an essential hypertension which develops over time. The cause is idiopathic. However, some persons show signs of dizziness, frequent headaches, fatigue, and nosebleed. Secondary hypertensions are caused by underlying conditions afflicted by the arteries that supplies the kidney. This can cause plaque buildup in the arteries known as atherosclerosis. For instance, adrenal gland tumors, excessive salt or alcohol intake, congenital heart defects. Another type of hypertension is the malignant hypertension, seen in African American men and women, and also pregnant women. This type causes blood pressure to rise quickly. As a result, persons require medical aid. Some symptoms are headache, numbness in the arm, legs, chest, and blurry vision. Lastly, we'll talk about the last form of hypertension is resistance hypertension. This is mainly seen in older people, obese, and those impacted by kidney illness, hormonal imbalance. Another illustration is some symptoms due to blood pressure being extremely high are chest pains, shortness of breath, headaches, and nosebleeds as well. Here are some contributing factors to hypertension: genetics, obesity, smoking, and salt intake. Here are some prevention measures one can take to limit their chances of hypertension. Implementing a balanced nutritional diet, limit alcohol intake, reduce caffeine consumption, get an adequate amount of sleep, and lastly, exercise.